diagnostic tool for people that are asymptomatic. So again, that ties me back into what I was sharing about following the clinician criteria. If you're experiencing those symptoms, those are the individuals that we want to prioritize and test first.
So why test this person?
So why test?
The confirmed case, why did you guys decide to test that person?
That was a test that came through one of our hospitals, and they in turn reported and shared that information with us at the state level in a multi-database system that does the reporting and findings. So that's how how that was determined.
So you just said you would be prioritizing individuals. So which individuals will you be prioritizing for testing?
Well, the individuals that are that are symptomatic on the clinician criteria that's there, people that are experiencing a fever is that what you're referring to? Okay, so I mean I can share with you with that. The symptoms of COVID-19 can mirror the illnesses of the general flu, but patients with COVID-19 typically display the symptoms such as a fever that's over 100.4 degrees or higher. You have the cough, you have the shortness of breath. Within the 2 to 14 days of exposure to the virus, approximately 80% of those affected with COVID-19 report mild to moderate illness. I think that's something key to underline and make note of. People who are more vulnerable to illnesses, including individuals that are over 65 years of age, those are important to identify, and individuals that have underlying health conditions. Those are individuals that we would certainly want to look at. Individuals that are immunocompromised as well. When we're talking about that, we're talking about people that are suffering with heart disease and diabetes. Those are just examples when we say an individual is immunocompromised.
And where is this confirmed person now?
I'm really not at liberty to share that. They're at one of our hospitals. Yeah.
So will you also be testing people who traveled maybe abroad or to an area that has a high amount of coronavirus activity?
We're certainly looking at the hot spots where they're coming from, but again, a lot of that's going to tie back into the clinician criteria that's there. Also too, you'd have to look at whether or not they're symptomatic. You know, that's the fluidness of this virus, you know, where one day you may be asymptomatic, the next day you could be experiencing symptoms. But we would certainly look at those areas and travel criteria, where they're coming from, and guidelines too. So.
And now I know you said that there were 22 people under investigation. Is that how many people have been tested, or have more people been tested, or do you know any idea?
I think it'd be safe to say that we've tested more than that. As far as an exact number, I wouldn't be able to share that with you, but I do know that the community in our county has been testing and screening, yes. Again, the thing that we have to remember, the more kits, the more testing, the more supplies that we get, the more testing we're going to have. You know, there's a correlation of that. So with that could come the possibility of possible confirmation cases. We hope not, but that is a real possibility and a realistic thing that we need to look at. So, but again, that goes with screening. You know.
How many people have tested negative?
The last number I have is 16 negative cases. 5 are pending, and the 1 positive case. So that's a total of 22 PUIs, persons under investigation that we have right now, that we know of right now. Yes.
This positive case, what time did you guys find this out?
It was early this morning. Early this morning.
Do you guys anticipate relaxing the strict rules for testing in the near future?
At this time, I don't foresee that. I think it's going to stay pretty strict, and unless we receive guidance from the CDC on that, I could say where the clinician criteria would stay pretty true to where it is now. But again, it is subject to change. It has. It's very, like I said, it's very fluid. And again, we're just kind of standing by and listening for our orders as we go with that.
What would you say to residents who are worried that tourists coming to the area from other places might be spreading the virus?
Yeah, I would have to second wholeheartedly with what our governor has shared over the last few days, that individuals really don't need to be traveling anywhere. They need to stay at home. If there's just not an urgent matter pressing, they really need to stay home and practice social distancing. And again, I think that's the best way to reduce the spread of the virus. You saw the governor where he addressed the spring breakers all over our state, and that does impact us. That impacts the Panhandle area and vacations and families that want to come and visit. But I think it is in the best interest of our state to practice those measures, practice those preventive measures like we're doing right now. We're social distancing right now, and that's good. That's encouraging to see, and I would just stress the importance of that. You know.
Now, you go ahead.
Okay, so do you know how many more tests we're going to be receiving?
I think I do have some information on that. Yeah. It looks like the additional test kits that are going to be available to the Department of Health and Florida healthcare providers to test up to an additional, I'm sorry, let me back up. It says that the Governor DeSantis announced that the state has ordered an additional 2,500 test kits. Okay, and then these additional test kits will enable, you know, the Department of Health to test our healthcare providers, and that's a possibility to be able to test up to an additional 625,000 individuals. So that's a lot of people. So
How many will the Bay Department of Health get?
you know, they're looking at that on a priority basis. You know, so that's a difficult question to answer at this time. As you know, down south in Broward County in particular, that's really the top priority county right now in our area that we're looking at. But we're reaching out with other private vendors along with community partners. There are other creative substitutive ways that we're looking at to test that's also coming down from the CDC as far as certain mediums and swabs and what you can test and how you can do that. So that's encouraging to be able to assist in the effort too. But I think that in the next few days or so we'll know more about our testing kits and supplies that we have that are coming into the state, which is really encouraging.
Now, I know that other areas are kind of more strict with the regulations that they put in place. What would have to happen for Bay County to kind of move toward a 24-hour type quarantine?
Yeah, that's a great question, because I know up north in New York and some of the other even California, I believe, is really looking at a total shutdown. I think the difference between our communities in Northwest Florida is we're not as heavily densely populated here in the Panhandle as you would find out maybe in Los Angeles or up in New York. So I think we have that going for us in Bay County. Is just there's not just we're not stacked up on top of each other in communities and in cities. I don't foresee that happening, I don't believe. Again, I can't speak for the governor. I'm not going to speak for the governor. We'll follow his guidance and directives on that. But I think that's some good things that we have going on. Also too, and I'm not a meteorologist or a weather person, but I think the weather is also possibly working in our favor too, with the humidity and our beautiful weather that we have right now. It's really nice, but that's also good, I think, in my opinion, when you're talking about the spreading of the virus too. That's a good thing for us right now, I think. And it looks like in our whole region, it looks like people are really doing their part, I think. I think there's some other counties maybe not too far from us, I think, that are maybe not following the congregation and limiting the group to 10 people, and that was a call that we were just on, and our state surgeon general made that very clear, that we really want to practice that social distancing and not be in groups of 10 or more, and stay at home. Definitely stay at home if you're sick, and taking those precautions. But going back to your question, again, Northwest Florida is totally different than New York City or California, and right now I think that's a good thing for us and our residents and visitors, yeah, that are here. Yeah.
So are the local hospitals and healthcare providers, are they getting enough supplies that they need to help individuals who are sick who might have the coronavirus?
I can't speak to their staffing supplies and their kits right now. I do know that we have a very good relationship and close communication with them, and I believe, as well as not just with our hospital, but with all of our community partners and physician offices, and the Department of Health is the lead agency, and I believe that if they had any needs unmet wants, needs, that they'd be reaching out to us for that. So to my knowledge, I don't know of any issue with them being able to screen and test for their patients that may be presenting in their ERs. So,
Do you know how many ICU beds there are in Bay County?
I don't have the answer to that question,
Or
and
at least a ballpark?
I'm that sounds like a hospital question, but I'm not sure. I'm not sure about that particular question.
And that goes along the same with ventilators?
And I was gonna answer that one for you. Yeah, I don't know about the ventilators either, because I figured you'd ask that too. So yeah, but again,
How
we.
many people have you guys had to actually turn away because they didn't meet, the CDC screening requirements or guidelines?
Yeah, as far as numbers and data for ones that were not tested, I wouldn't have that number right off the top of my head. I wouldn't know right now, but we could certainly look and see if we could find that for you. Again, it's I guess the important message is that I would say is that it's really for the strict clinical criteria of individuals that really meet the signs and symptoms of COVID-19. I think another point of importance would be if someone feels that they're sick or experiencing symptoms, to call their provider or call the health department first prior to going in and visiting the physician officers or coming here to the health department. Because you want to, stop the spread, call ahead is something that we're trying to practice and share with our community. So.
What are some of the basic symptoms? I've heard it's kind of similar to bronchitis. Is that accurate, or?
Well, I think I shared that a while ago, but I can share this information with you as well if you'd like. But I think the biggie that you want to look at is the fever.
Okay.
Of 100.4 degrees Fahrenheit or higher. That persistent cough that's there, that shortness of breath. And again, within that certain period of that 2 to 14 day window period, those are really characteristics of COVID-19 that they're seeing. So,
how long is it taking the, more severe cases to recover?
I wouldn't have that information just yet. Again. I think different people recover at different times based on their condition, their age, their underlying medical conditions. You or I, if you got it and I got it, we both got it at the same time, I may recover quickly than you do because you may have something else going on with you that I don't, or other things. There's a lot of information out there. There's a lot of data that's going to come back when this is over with, and we'll get over it. Our country will get over this and move forward, but those are the three or four top characteristics of the virus that's important to remember. Yeah, those are really the keys, and in addition to some of the travel criteria that we talked about earlier, and making sure kind of where they are and any type of possible exposures that they may have.
So this patient who tested positive, how long was he in the area before he got tested?
I'm not exactly sure on that, and not sure I'd be able to share that if I did know.
Do we think he had a lot of contact with a lot of people?
Well, I know that I would be confident saying that we're investigating his possible contacts that he's had. I know that our staff are doing that. So.
Do you guys believe that the positive test came from community contacts, since it's not listed as travel related?
Yeah, that's just kind of still to be determined at this time on that question. Yeah.
So there's no way to determine how or who he had contact with?
Right now, no. I was going to see if there's some other information I could share with you that I have.
Some of the pending tests that are going on, are any of those people related to or had contact with this confirmed case?
I wouldn't be able to share that with you, but we've got 5 that are pending that I know of right now. Again, we're again, we're watching it very closely of when we get reports, and as soon as we find out information, we share it with all of our community partners, our county and municipalities. You know, our press releases, Ms. Kretzer's done an outstanding job. She continues to do an outstanding job in sharing information with the media and with our community partners and everybody. So I'm very proud of our response the Florida Department of Health is doing. It's a massive event. It's a massive event. Hopefully a once in a lifetime type of event. But I'm very pleased with what we're doing and how we're assisting our community. So
should people be concerned about the community spread?
I wouldn't go that far to say at this time. I wouldn't think so. I think Broward County may be a different story, but here I don't think we're experiencing that just yet. I don't think we're at that point yet. Heather, anything that we need to?
Either way, people still need to take the same precautions that we're asking them to take, whether we have case, whether we have community spread or not. It's the same guidelines.
Yeah, and another thing too to remember too is still flu is still very present. That would be something you may want to include in your reporting as an aside, that flu season is still very much with us, and you hear things where people think they're sick with this, and it's really not that. It's the other. It's really the general flu. So, which is still serious and important to take care of and take precautions. So,
How long does it take typically to get a test back?
5 to 7 days is the number of days that
So
it.
this confirmed case was tested last week, originally.
Huh? Okay. Yeah.
So who was working to identify how many people this guy had contact with?
Well, we have our epi staff. We have a mid-level APRN who's our chief of the epidemiology division here at the health department, and we also have RNs, specialist epi-RNs that are here on staff that are working in conjunction with our hospitals to be able to look at those contacts and to do that contact tracing procedures is what that's referred to. So they're on top of it, and
So
they're working.
Doctors, people who work for the health department. Sorry, you just used a lot of acronyms. So
I'm sorry, a mid-level or a nurse practitioner, and then RNs. Our staff, yes, are working that along with, in conjunction and collaborating with staff at both of our hospitals. So.
And I'm not sure if you guys are allowed to say this information, but the confirmed case, so he's being treated in Bay County right now? Okay, and then do you guys know if he would be going back to Texas, or is it somebody that moved here?
I couldn't speak to that. I'm not sure about his travel of, why he was here or when he's going back, or I couldn't speak to that. But I appreciate y'all coming out, and I hope this was very informative for you, and I hope that you'll put it in a good light, put it in a good way, because that's important for our community. It's important for our health department, and so I appreciate you coming out. Heather, is anything we need to share?
Thank you so much.
Yeah, absolutely. I appreciate y'all coming out, and I appreciate y'all coming.